It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives, changing lives, changing lives for the better, changing lives.
Hi again, everyone. Jim Knox. Welcome back to another edition of Best Docs Network, which features some of the best doctors in the Houston area that help change people's lives, like our first doctor, plastic surgeon, Dr. Michael Eisemann.
Kimberly was born premature, so we had quite a bit of time in the hospital, about 6 weeks after birth. And it was about 2 weeks into that there was some discoloration to her left cheek and her lower lip. And that later started to grow, and we found that it was hemangioma.
Kimberly was born with a congenital hemangioma, which is a blood vessel tumor. It involved the skin of her face, and it also involved deep structures as well.
Coming to Dr. Eisemann and him explaining that it would be a process, but there would be a time that we really wouldn't be able to look at her and know the starting point with regards to the growth.
You know, we basically like to tell them in advance what we're planning on doing, and in her case, it's a staged procedure, and it was planned just that way. If you're trying to do too much at one time, you know, it can even be dangerous as far as the bleeding is concerned. So we tell them in the beginning that we're doing as much as we can at that time, and we probably removed maybe 20 to 30% of it, probably the first operation, and she's had 5 or 6 operations since.
I was excited because after all of this, I actually look like this. At first it was a lot, like all around my face, but it was, now that I look back at it, I'm actually really excited or happy.
There have been times that she came in after surgery that from the point of entry, we would hear, Kimberly's here, Kimberly's here, Kimberly's here. And people would come out, you know, and just, hi Kimberly, how are you, Kimberly? And that means so much, and especially for an 8 or 9-year-old who's bandaged from surgery, you know, it just goes without saying that his office staff is so supportive and so caring.
It makes me feel nice that he cares, or that he asks, like, that he is nice enough to ask me how am I doing, or how is life going for me now.
Well, it's changed her life, you know. I can't imagine her going on life the way she was before without having had surgery. I don't think she can either.
I would say that people don't stare at me or talk about me or anything like that. They treat me nicely, and now I just feel really excited or happy to see that I can do all these things confidently because of Dr. Eisemann.
We have young people who are already having thickening of their heart muscle. They're already not quite having normal function. And it's the earliest signs that there's a problem there, that the heart's working against a large extra load that it normally wouldn't have to.
When I originally started to even look into this after I talked to my friend, I was probably between 335 and 340. I'd been that for 10 or 15 years, been over 300 pounds for at least 15 or 20 years.
We're giving them back some of that control in that one area where they've had a problem. But it's a dangerous area. I mean, you can't walk around at 310 pounds and think everything's going to be okay for very long. It's not.
There's been times when I'd lost weight before. I've got down to 225 before, but 6 months later I'm back at 300, and that was always my issue. And after you do that 2 or 3 times, you know, why do you want to do it again? Because you know what's going to happen. I actually had a buddy of mine that did the surgery probably a year before I started looking into it, and he had had great results. His weight loss was incredible from what I'd seen, and I've known the guy for several years. And he was completely happy and excited with everything. So that's when I started looking into the surgery myself.
Buck has lost 115 pounds in about 6 months after having a sleeve gastrectomy. So I mean, that's a good outcome so far. We're only partway through. We're going to expect more weight loss beyond that. Although he's clearly getting down towards his ideal body weight, which is where we'd really ideally like to have him.
I started off at 335 or 340, January of 2011. And it's February of 2012, and I'm at 186. It's like being reborn. Before, I guess I just kind of just muddled through life. No excitement, just do what I had to do to get by, no energy, no fun. Now, I mean, the excitement, fun, romance, social life, things that I didn't have before. You changed my life. It's a whole new world every day.
Cynthia wanted to lose body fat in certain areas to get ready for her big wedding date, and she did that with the help of Dr. Lucian Rivela. To find out more about Cynthia's story and other life-changing stories, log on to bestdocsnetwork.com.
Jill came to see me for hearing loss. And then while she was here, she was also talking about, she told me she had some allergy problems, and then also the snoring and it was feeling like she had insomnia and she couldn't stay asleep during the night. She was tired during the day, wake up with a dry mouth.
I think you have sleep apnea. I'm going, oh, what's sleep apnea? He said, well, sleep apnea is where you don't get any REM sleep and you don't sleep well. Are you tired a lot? I said, I've always been tired.
We obtained the sleep study and found out that she had a lot of sleep fragmentation from snoring and from sleep apnea.
He said, well, we'd like to do the second test, of course. We diagnosed the fact that you do have a sleep apnea. So went in another night, electrodes, but I had a mask this time. And I fell asleep. I woke up the next morning. It was like, wow! I mean, geez, it was like, I am so rested. So he didn't have to do a hard sell or anything with me. I mean, he said, you need a BiPAP machine. We've decided that, and this is why. And he sat down and explained everything to me.
If you have the other effective treatment option, and you decide to have surgery, and there's something that I think that we're going to do that has a good chance of making you better, then let's do it. But for some people, it's just not their best interest, and she's happy. Jill sleeps every night, has no complaints, she loves it, it's safe, it's effective, guaranteed to work. Are we going to beat that with a surgery? No, we're not.
My coworkers at the time noticed an immediate difference between, I didn't tell them what was going on, but they noticed an immediate difference in my demeanor and my approachability.
If that therapy makes you feel great, I just think that your opinion of that therapy is going to change, right? Now, if you can't use it, you're claustrophobic, and you have an obvious anatomic problem, then sure, let's go down this other path and we'll make you better. But better and perfect aren't the same,
It's made a great impact. It's really, the only thing I miss, and this is going to sound crazy, but I'm used to having 22 hours in the day as opposed to 16 or 17, and I can't get as much done as I used to get done because I'm sleeping. But the trade-off is great.
There are three kinds of skin cancer. There's squamous cell carcinoma. That's the kind that occurs in scaly lesions that grow in size, usually in the sun-exposed areas. There's basal cell carcinoma. Those are gray and pearly with sort of heaped up raised borders, usually again in sun-exposed areas. The most important and most dangerous skin cancer is melanoma. That's what occurs in moles. We use the ABCD rule to decide if a mole or skin lesion looks like it's bad. A for asymmetry. If the lesion doesn't look perfectly symmetric, then that's a bad sign. B for border. An irregular border is a bad sign. A regular border is a good sign. C is for color. If a uniform color occurs in a mole, that's good. If there's multiple colors or irregular colors or a change in the color, that's a bad sign. Diameter. 6 millimeters is the magic number. Anything bigger than 6 millimeters is bad, and that's about the size of an eraser. So take good care of your skin. You only have one layer.
In October of 2011, I was diagnosed with stage 1 breast cancer and was advised that I needed a lumpectomy with internal radiation. Maybe a gut feeling kind of told me that I needed a second opinion. After looking at all my history she actually recommended a bilateral mastectomy with reconstruction. So that's what I did on April 3rd of this year.
Breast reconstruction is a very rewarding surgery that we do for the patients. It's women who are going through, some of the most difficult times in their life. They've been given a diagnosis of cancer and been informed that they may lose one or both of their breasts.
I came and talked to Dr. Feldman about the whole process, and of course I was nervous, and I know I even started crying at one point, but he was so supportive and just assured me so many times I would be in good hands and I would love the results. And
so she chose to have an expander and implant-based reconstruction, and that allows her to have a reconstruction that doesn't have a second surgical site. So rather than having to use muscle from her back or from her abdomen and impacting her golf game or her yoga or her active lifestyle, we're able to use implant-based reconstruction, which is a very nice result with really nice technology that's available to us now.
Just fabulous, yes. And he did a great job, and I had total confidence in him. And I've been feeling actually pretty good. I'm kind of wanting to get out and play golf, which I haven't been able to yet, but actually I feel really good.
Every patient has individual concerns, and whether it's lifestyle, whether it's recovery, whether it's, can they get back to their job or take care of their kids, that's something that we take into consideration with every patient. The surgery's gone so well and she's so confident with her results that she wants to be out and move on with her life and put the cancer behind her, and we've really been able to deliver her a nice result that she's able to do that with.
So many exciting things have happened since then. Not only the good prognosis with the surgery, but we're engaged now. Hopefully my daughter will be graduating from college soon, and I'll be able to retire early next year and kind of just move on with my life in a positive direction.
The ideal patients for dental implants are ones that have been through lots of restorative procedures, and where these procedures that just aren't predictable, and so we were able to give them their third set of teeth with the use of dental implants.
I had an accident when I was 10 years old, and I fell down on my face and I dislocated my jaw. And I didn't know that then, but I started looking for the oldest doctor or the one with 35 years or more of experience. So I went to the facility in Gessner and I saw Dr. Metz, and they said, this is the guy who's gonna have to be working on you. I had to decide if I wanted to go through with it, and I did research. He graduated top in the class.
So in Tico, we were able to move his upper jaw forward and set his lower jaw back so as to help line up his skeleton so that his teeth meshed together well. We, as specialists in oral surgery, are uniquely qualified to provide these procedures.
I just figured out this is the best facility, this is the best doctor, and I truly believe that, Dr. Metz and his team, they know what they're doing.
These patients, when they come down the hallway, when we see them after this procedure, we see their level of confidence has gone up tremendously. We can tell by the smile on their face as well as their dress. They're dressed sharply and they're holding their chin up. You can certainly tell that they are happier individuals afterwards. Technology today has really revolutionized how we practice implant dentistry. We have cone beam CTs, which allow us to take a CT of the patient in the office, and in about 20 seconds we have 360 degrees of bone around the implant. So we know ahead of time whether we need to graft and also the type of grafting that we need to do ahead of time. So patients are better prepared for the experience and know more of what to expect afterwards. We're able to do this in a safer fashion. And it's much more rapid. The procedures are much more rapid, and the recovery is much easier as well.
For more information on any of the great doctors you see on today's program, head to the website, bestdocsnetwork.com. All right, now it's time to head to our next doctor, one of the top hair restoration doctors in the Houston area, Dr. Rashid Rashid.
My name is Rashid M. Rashid. I have an MD and a PhD. I was born and raised in Puerto Rico. Went on to medical school at Loyola University. I did a combined degree program. I did an MD and the PhD at the same time. So it took me 7 years. Normally, if I had done them separately, it would have been a 10-year program. I've always had a very strong interest in research. I really like to understand where the information we use comes from, why we use the information we use, and why things are happening. I trained at MD Anderson, so when I did my training there, I had the opportunity to do rotations in clinics around the country, including at UCSF and other clinics that specialize in hair loss. So it always fascinated me to be in this area where few people were in, and where it really matters to people. It really matters to people that they're losing their hair. And yeah, we have over almost 70 peer-reviewed papers, all in journals that have very strict criteria for publications, including national journals like academy journals and our specialties in dermatology and medicine, trauma, across the board. Our hair loss papers mostly focused on things like other peripheral associations with hair loss, like vitamin D deficiency. We have a paper that is often cited about vitamin D deficiency and hair loss. We do a regular daily auditing of the peer-reviewed research, and we regularly review and examine what's out there. We consolidate that, we provide that in an updated blog we have online, and it basically summarizes all the main new research ideas that are coming into place or they're just being developed by scientists and physicians around the world. So our method is called the follicular unit extraction. That's been around for a few years. It used to be done manually, hair by hair. It would take a long time. Now we have different devices and machines that have sped up the process, so we can do larger cases in less time, and the price is also more acceptable to people than it used to be. You would get more hairs, get back to work, and a lot less downtime. And the healing is very, very quick.
A bunion deformity is a deviation of the first metatarsal and the second metatarsal. So basically, what people see of their big toe is this. So the big toe is pointing this way, and this bone is going out this way. When it's not matching up well, you get bone growth. And so bone starts to build up right here, and it also starts to build up top.
I spend about 85% of my time traveling, so I'm in and out of the airports. As a training manager, I do a lot of facilitation, so I'm on my feet a lot walking, and it got to the point where even flat shoes, what most people would think of comfortable shoes, became painful.
Her surgery was an Austin bunionectomy, but it was a little bit different because on the x-ray I discovered that she had severely arthritic joint. She had fracture fragments. So these fracture fragments never healed, and because they were constantly moving, it was severe pain. It caused an enormous amount of bone growth on the top and on the side. So I was really excited to do her surgery because I knew it would provide immediate relief.
I'll be wearing the boot for at least another 4 weeks, and then I'll come back for another reassessment. And then he'll determine then whether I can take the boot off and then just start walking in normal shoes.
People always ask, why do I have this problem? And the biggest component is genetics. So if you look at your parents' feet or your grandparents' feet, it's basically telling you, if you see a bunion deformity, that your chances are your feet are going to develop these structural deformities. Then obviously for the females, it's wearing the high heels. It's there's a price to pay for high fashion. You wear the high heel, it puts your foot in position, which predisposes you to a bunion deformity.
I would love to be able to get back out there and be pain-free. A lot of times I couldn't wait for the day to end because I would be in so much pain. So I'm looking forward to being able to be on my feet for a longer period of times pain-free.
The look on the patient's face when they come in and they see the results and they're happy with the results, and they see that instead of having a crooked toe, or that it's actually straight, and that the pain that they had before is gone. So, that's the rewarding part to me.
Dr. Meredith Morgan is one of the best physicians in helping women manage menopause. Practicing for over 35 years, Dr. Morgan, as you see, has a unique office. It's located in the Museum District, a freestanding facility with a relaxed atmosphere. Today's topic, perimenopause.
It's really important to understand that this is a normal process, and it happens with all women. It starts in their mid-40s, the average age of onset is 47, and on average it lasts about 4 years.
According to Dr. Morgan, perimenopause represents a change. Women will experience a number of symptoms.
This is a time of relative estrogen deficiency and brings on mind, mood, memory, and even sleep disorders and irregularities. Yes, there are hot flashes and night sweats that most women think of as menopausal, and yes, they can be just as severe as the postmenopausal ones. But the differentiation between transitioning and a non-cycling constant state is the unpredictability and uncertainty that can be so distressing to a woman.
For women experiencing perimenopause, Dr. Morgan outlines the next step.
We have 3 levels of management. The first will be basically lifestyle adjustments and home remedies. The second is non-hormonal medical prescriptions, and the third is hormonal management. We want to treat at the lowest dose for the shortest duration, consistent with what the need is. We have to understand it's important to use what is acceptable to the woman herself. In my mind, without a doubt, we've taken a step forward for the city of Houston and its surrounding environments. We've developed a site that is comfortable and convenient, that provides medical center quality with minimizing the hassle that's involved. It's been very rewarding to have done this for the last 10 years, and I'm looking forward to the next 10 and 20 years in continuing to do and help women throughout the entire region.
12-year-old Kyle loves to play baseball, but it was hard to do due to allergies. That is until he met Dr. Lynn Dickens. To find out more about Kyle's story and other life-changing stories, log on to bestdocsnetwork.com.
Here at Rivela Plastic Surgery, we perform plastic and reconstructive surgery. We emphasize aesthetic procedures, primarily of the breast, body, and face.
I was predisposed to like a droopy jawline, and so that began to be my focus when I looked at myself in the mirror.
Cheryl came to me with the concerns about her, again, the jowling area and deep lines on her face. She's a yoga instructor, and in particular the Bikram type of yoga where it's very hot, and I think she perspires a lot and is very thin, and she noticed her skin sagging. So to help her with that, we did what we call a mini facelift.
I talked to the staff first and then had a consultation with Dr. Rivela, and he recommended doing a mini lift. I felt like I was ready to do that, and you know, just with some guidance and the questions that I asked and the way they were answered, I felt like it was a comfortable procedure for me to move forward with.
In general, most of the patients are women that come for a facelift. They're in their early to mid-50s. They have the signs of some jowls and what we call marionette lines. Those are lines that go down on each corner of the mouth. They have some wrinkled skin on their neck, and so that would be probably the ideal patient.
I'm only 3 weeks out of my surgery. I feel like, you know, I'm really happy with the results.
Well, it's a good feeling to know that she now feels more confident, and she's of course smiling and very happy with the results, so of course I feel good about it.
I feel like that with the advice and the treatment and the service that I get at Rivela Plastic Surgery, I'm able to really maintain a level of confidence that allows me to get in front of people, and you know, most of the time with no makeup on, and I feel really good about myself.
I took on the role as bariatric medical director here at Methodist Willowbrook in January of this year. What I wanted to bring together was a comprehensive team of interested specialists. We put together a group of individuals who are very much interested in weight loss, both medical and surgical, and we're Basically, we're centered around the patient.
It's a patient-centered approach, and the patient's at the hub, and then the spokes that come out from it are the surgeon, the psychology of weight loss and how that affects them, what may have caused them to gain weight and to get into this predicament where they suffer from morbid obesity. And then the dietitian, the registered dietitians that we have here as another aspect or another spoke around the hub of the patient.
The reason why we gain weight is a multifaceted problem. Really, there's no one approach that's going to solve this issue. Some of it's genetic, some of it's environmental, some of it's cultural, and so we have to look at it that way. At Methodist Willowbrook, we do 3 of the procedures for weight loss. We do a Roux-en-Y small pouch gastric bypass procedure, we do a laparoscopic gastric sleeve procedure, and we do the lap band.
We have weight loss surgery seminars at Methodist Willowbrook Hospital. At those seminars, I think patients really get to hear some of the finer points of the surgery about what we do and why we do it. Just to have that satisfaction of knowing that someone's diabetes is resolved or their blood pressure is no longer requiring medications to control, their cholesterol is better, they no longer have sleep apnea and they're finished using their CPAP machine. And then as a nice byproduct, from a cosmetic standpoint, the patients look better, then they also develop more confidence and they feel better. And so we're all about making patients healthier, but we do also have some of the other added benefits of patients feeling better about themselves and how they look.
The surgery, almost anybody can do this surgery. It's the whole package. We think that's important, and I think that's really what sets us apart from the average institution.
I've never really had acne until I was an adult, and I started working out more than normal and experienced some acne on my back, which I thought was acne, which was later diagnosed as folliculitis.
Folliculitis is a disease that's basically irritation, inflammation, and infection of the hair follicle areas. And this is mostly prominent on hair-bearing areas, especially on the face, and the upper back is a very common location.
Just going from always being able to wear whatever you wanted to now having folliculitis to the point where I could not wear just any cute shirts or anything like that. Everything had to be covered because it was that bad.
I've been starting to recommend and refer patients to use the CLN body wash since it's been available to me recently. I find the patients are very happy with it as it spreads on large areas easily. It can be used in the shower, and it's very cosmetically elegant. A lot of the patients like the way it feels on their skin.
Dr. Sklar looked at my back once. He said, "You have folliculitis. Try the CLN body wash." I tried it and it worked perfect.
In Dana's case, she had the typical, what I see a lot of times, especially on the upper back and upper trunk, of these small pustules and infected looking lesions of folliculitis.
In the beginning, I used the CLN every day just to see if it would work. I started seeing gradual improvement within 2 to 3 days.
It's nice to not have to use oral antibiotics to treat this. We put her on the CLN body wash and she saw dramatic improvement within a week, probably 50% improvement. She was very happy with the product and continues to use it as a baseline to help control this condition. And it's so nice to have something new and so novel that we can treat this with. This is really a whole new concept. We've not really been approached with using these bleach products for these common diseases such as acne and folliculitis.
The CLN body wash is amazing. It cleared up my back and I'm back to a normal life.
That'll do it. That'll wrap up another edition of Best Docs Network, which features some of the best doctors in the Houston area that help change people's lives. And for more information on any of these great doctors, as well as procedures, head to the website, bestdocsnetwork.com. And if you have a question or comment for us, we'd love to hear from you. Send us an email at info@bestdocsnetwork.com. So long, everyone. We'll see you next week.